So again, this is the second talk is ATOS. It's fortunate enough to have done the first human trials of 35 patients, and then Kishore Pradhan took up the second set of cases. Zima is very innovative in its thought process from the time it started its lasers to the time we have the ATOS platforms. And what's important is I will skip these things because I'm sure everybody has covered this. Again, interesting aspect is the difference between a conventional high energies versus low energies, about the low energy pulses, focus. I mean, we have heard a lot about this. The thing is, when we had only one machine, none of us ever spoke about it, but today I think everybody has to be aware of it. What's interesting is it's got its own eye tracking. You can connect to your MS39 or your Cirrus. Precise. It has a very different geometry, even though it might be a little challenging to dissect this lenticule sometimes. Large flaps, and it has a curved interface, and the software is the typical Schwinn softwares. They play around with their energy spots. They're a little different. They have asymmetric offsets, means the spots energies are not in one plane. They can play around with it, and they have more SOPs. That's what brings them a lesser amount of cumulative energies as shown by Kishore Pradhan. The best thing about this for me is the ability to connect to the best of our favorite diagnostics, the Cirrus or MS39. So you have all the platforms. An advantage here is that when you connect a very good diagnostic, you know that tomorrow you can create a topo-guided treatments or a aberration-free treatments, and that's where I think it's heading to. And you can customize the platforms, customize the geometry based on the curvature and other even stromal mapping. Cyclotorsion is a great one because this is, again, as I mentioned, it's connected to the diagnostics. You don't need to do any manual cyclotorsion in this. It's already planned, and this is how you. It is a single. Only challenge is the way the whole orientation is. If the camera is placed at an angle which looks very scary, everything looks like there is decentration. I don't know, with such an innovative company, this is such a challenge. And even though it does give you a very smooth dissections, and it's the same. This looks like it's completely decentration, but trust me, it is not. And these are the energy settings which you can change. One of the machines which makes energy, spot size, separation looks very simple. The software is very intuitive, very simple compared to many other procedures. And one thing about this is, like Sir said, apart from Smile, you don't have a rescue software. Here they have built in a rescue software where can you click incision only, side cut only. I mean, don't have a side cut, and you can redo the procedures. So for a beginning surgeons, you have that version which is expected. We did work on the low energies. Cumulative energies have a huge impact. We worked on this is a Pentacam OCT. The reason I use Pentacam OCT is it's got a resolution of close to 1 microns, and so beautiful that you can even look at the layers of epithelium out here. This is the basal layer, the superficial layer out here. So that the beauty is that you're able to look at every layer, which is much more finer. So your wrinkles suddenly becomes more magnified. Every machine has wrinkles, but we try to quantify it. The energies, like Ramurthy sir mentioned, the energies do have an impact on the effect of Bowman's, and that's something which is have an impact, and they quantified it also, which is as published in this paper. The one interesting aspect of it is we wanted to study all the machines and see how different energies have an impact on the extracellular matrix and healing. This is what I just mentioned to Dr. Ganesh sir when he was speaking about it. There are different things. This itself will take a long time if I discuss. And these are factors we see nowadays with a lot of inflammation in the cells. And this is the experimental model about looking at more than 20,000 genes which are responsible for healing. These are the mass spectrometry out here. So I'll come to what is interesting here. ATOS causes least amount of so the apoptotic genes. Dr. Tityal sir is here. He has worked a lot on these factors. You can see the BCL and BAX. Alpha SMA is something which makes your cornea to heal slowly. And this is exactly what I was telling Dr. Ganesh sir, that if you have a different level of alpha SMAs, you will look at this variation out here. That means that a patient who is elderly will have more of this because he's cross-linked over time, and he will have more of these BAX genes because there is a lot of other apoptotic changes which has happened. So that's why one of the reasons is, if you see here, you behave differently with different age groups. Women in different stage of menstrual cycle will also have different stages of this, because every hormone has a different state in which it works. So it's very important to understand this. And I feel at this point of time, the most sensitive on the healing aspect of genetic healing is ATOS compared to all the other platforms. How it translates to clinical outcome is something which we have to correlate. This is the scanning electron microscopy. This is how a collagen fibers are. If you can see, this is the collagen, each of those collagen fibers. When you take out a lenticule, when you use unwanted heavy energies, what Dr. Ramurthy sir said, that you may look you're happy, but you are completely use more energy to kill the same thing, because the collagen is completely collapsed. You can see those fibrils. But when you have this collagen which has come out as healthy as your cornea, that means you have been very gentle on it. And how do you prove it is by these things that you still see that they are very, very gentle, both on the molecular genetic aspects and also anatomically out here. So what's important is these machines may be safer when you're using it on a patient with already a dry eye or a contact lens intolerant patients. Much smoother on your Baumann's, which is what Dr. Ramurthy sir mentioned. And because alpha SMA and collagen 1 again has greater Baumann's wrinkles. That's why when you go older, this again follows what I discussed with Dr. Ganesh Otis. So just to summarize on this aspect of it, there are two things which I'll just say in the interest of time. Is it has a foresight, which is interesting because it gives you a prediction of how your cornea would shape post-surgery. They've used their own AI and mathematical modeling, something what I said. They're also trying to incorporate the biomechanics into the picture. So it gives you an idea about how much cornea you are shaping, how much corneal curvature you will end up with. We all can calculate manually, but this is something which is a completely different one. So Centrex is where it will automatically center based from the topography, and this is the software which they're going to introduce this year, and this is going to be connected to the diagnostic. That means it is going to be focused exactly on your line of sight, so there's no manual decentration because the laser is going to be centered at where you see. So these are very, very innovative things from this company here. One is the biology itself, which makes it better. We're just trying to write this paper up. It's a completely new form of epigenetics here. It has a definitely, when you have a less of inflammation, it has a better healing, especially in your dry eye and other challenges. And the surgery itself is a little difficult because of no side cut, and this gives you a better outcome. Thank you.
Thank you very much, Dr. Rohit. Now we will go to the last talk. You have a question, sir? Yes, please. Yeah.
Open to all those sitting here, in the sense that we keep talking about the speed, size the spot, and the spacing and other things. Ultimately, at the end of the day, I believe that the total energy delivered is nearly the same across all platforms. It's just the mix of these, because depending upon the biomechanics of that individual cornea, you require a certain amount of separation for removing the lenticule. So all this, that slide, I think 4 of us have shown that same slide about the distribution, and every clex that gets discussed. But does it really make a huge difference? I mean, Rohit, what's your take on this? And
well, if I understand what Rohit always tells us, it is the response of a tissue which will make ultimate difference. Whichever energy you use, how much spot you have used, It's actually the collagen which is going to respond, which will make a difference. What is he talking about?
I agree with sir. For example, if you have a cornea which has a certain level of Young's modulus of 120 newtons per meter versus a collagen which is around 80 newtons per meter. So when you have it, when you're using a cumulative energy of around 800 nanojoules, both of them will behave the same. But when you use say 1000 nanojoules, the one which is lesser newtons will have that collapse features. And that collapse, you rightly picked up you rightly said in your talk, which is very interesting, because when you have a easy dissection sometimes, that means you use more energy to a cornea, which is not necessary. So that's why when you never pick up all these things clinically, but if you look at statistically and go each individual case by case, and then you'll figure out that this is why somebody is not seeing. So it does have to make it to end this answer, it does have a role, but our understanding is very limited at this point of time. The companies have to put more efforts into.
My question was, is the total energy delivered by different platforms
Is different, sir.
is different?
Is different, sir. In fact, in theoretical optics, silk has more energy cumulatively. But what it does is, because the laser spots are so small and precise, that cumulative energy is actually nullified. The least amount of cumulative energy is by ATOS, because they are looking, that's what Kishore Pradhan says, they're looking at around 400 to 600 nanojoules cumulative energy, compared to around 900 to 1000 with the other. This is what he calculates. But companies don't agree, all companies don't agree to it. But if you go by the pure theoretical optics, there is difference.
Practically, if you have a very easy dissection in one eye, should you be going down on your energy in the other eye?
Theoretically, yes. Theoretically, yes, because
otherwise, how do you apply it?
Because
Because one eye is going to be different.
easy dissection means the collagen. In fact, when I have an easy dissection, and especially with smile, I know that this cornea is not going to be something for me a red flag. And I tell them that I want them to be called at least 6 months here. I do a baseline test, because I don't want them to go into ectasia after 5 years. And if you look at all your smile extra patients, the dissection is very easy. And because you hardly have any collagen there.